Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Today's episode is Planning for Pregnancy with Lupus. We know that planning ahead with your healthcare team is essential to having a safe pregnancy with lupus. So whether you are newly diagnosed, newly pregnant, or interested in learning more on safe pregnancies with lupus, we know you will benefit from insights shared today. We are thrilled to bring you this episode in collaboration with HopStep and with expert Dr. Megan Close, rheumatologist and associate professor of medicine at Duke University School of Medicine, with expertise in management of lupus and other rheumatologic diseases throughout pregnancy. Thank you, Dr. Close, for joining us today.
Today we're going to talk about planning pregnancies for women with lupus. Our goal at lupuspregnancy.org is to help all women with lupus to have the families that they want to have. Unfortunately, some pregnancies in women with lupus are very high risk for pregnancy loss or an early delivery. Pregnancies that are conceived when a woman's lupus is very active, in particular in her kidneys, when she's taking a medication that can cause birth defects, such as methotrexate, mycophenolate, or cyclophosphamide, or if she has untreated antiphospholipid syndrome, all are at about a 40% chance of resulting in a pregnancy loss. But what we know is that really how active your lupus is at the time of conception is what drives a lot of pregnancy loss in our population. But we know if you control the disease activity and end up with a lower disease activity and the protein has been taken care of, that your risk of pregnancy loss decreases to about 20%. Which is still bigger than the general population, but it's certainly better than it would be if your lupus was really active. Additionally, these pregnancies are at high risk for an early delivery, with up to 70% of them delivering more than 3 weeks before their due date, and some of them delivering several months before their due date. Pregnancy can also put a woman at risk for her own health when she has lupus. If you've had a blood clot in the past, or otherwise are at high risk for having a blood clot with your lupus, please talk to your obstetrician or rheumatologist, as they may want you to take a blood thinner throughout pregnancy. Some patients with lupus will develop increased disease activity during their pregnancy that can lead to harm as well as pain. But the good news is that we can actually prevent a lot of these pregnancy losses and early deliveries by both controlling your lupus and using medications that are safe in pregnancy. And in fact, when we look at the data of patients who are pregnant versus not pregnant, we don't see any increase in flares as long as the patient has stayed on her medication during pregnancy. The key to safe lupus pregnancies is having your lupus as controlled as possible with medications that are compatible with pregnancy. We've made a handout that you and your doctor can use in order to effectively and safely plan your pregnancy. We suggest printing it out, taking a look at it, and taking it to your rheumatologist. It's really a handout that's supposed to facilitate the conversation with your doctor. It helps the doctor have really good information about what's safe in pregnancy, and they will help you interpret it to apply to your own health. Let's walk through the steps that you need to go through to have the safest pregnancy possible. So the first question is your lupus well controlled? This can be really hard to answer, so please talk to your rheumatologist to really apply this to yourself. Our goals, however, is that you have minimal signs of inflammation, that you have very little to no inflammation in your kidneys, so you have really low levels of urine protein, and that you haven't needed prednisone for a flare within the last 6 months. Some women think that taking medications during pregnancy can be too dangerous. However, when you have lupus, it really turns out that taking medications during pregnancy is less dangerous than avoiding them altogether. We know that taking medications can control your lupus better during pregnancy, and this decreases the risk of pregnancy loss, of early delivery. In addition, it will help you to avoid a flare, which can certainly be painful and can harm your body. So what medications are right for pregnancy? So there are several that are really safe in pregnancy. We have great data to tell us this, and those in particular are hydroxychloroquine and azathioprine. Those are the medications that are used by far the most in our lupus pregnancies to control disease activity. And in fact, hydroxychloroquine is really recommended for everybody who has lupus who's pregnant. Prednisone is also considered safe in pregnancy, but we recommend that you use it sparingly. Your rheumatologist might even start you on another medicine like azathioprine to be able to help you get off of prednisone and keep your lupus under good control. There are some medicines that we use for lupus that are known to cause birth defects, and we call this the stop list. These include methotrexate, mycophenolate or Celcept, and cyclophosphamide or Cytoxan. These all increase the risk of pregnancy loss to about 40% and can cause birth defects. There was a very nice study done that looked at methotrexate use in pregnancy. These were pregnancies in which the woman got pregnant, probably by accident, and ended up taking methotrexate for a period of time early in pregnancy. Those patients were also then compared to a group of healthy women without methotrexate, as well as women with autoimmune diseases who didn't have methotrexate. What we know is that the general population's birth defect rate is about 3%. So 3 out of 100 pregnancies in just normal healthy women will be born with some sort of a birth defect. If the woman takes methotrexate during pregnancy, however, particularly in the first trimester, we know that about 6 or 7% of those babies will be born with a major birth defect. So that risk is about twice that of the general population. What that means is that over 90% of babies that are born alive after being exposed to methotrexate will be born without any birth defects. When we look at mycophenolate and cyclophosphamide, however, what we see is a much higher rate of birth defects with first trimester use of these medications. So over 25% of babies that are born alive after mycophenolate or cyclophosphamide exposure in the first trimester will have a major birth defect. So it's important to talk to your doctor if you're taking one of those and want to get pregnant, because your rheumatologist will want to switch you from one of those to one of the medications on the pregnancy compatible or go list, most often azathioprine. For all these medications that may cause birth defects or those on the stop list, it's important that you work with your rheumatologist to get off of them safely before you get pregnant. So your rheumatologist will likely replace them with another medication. If you find yourself pregnant on one of these stop medications, the first thing to do is to stop the medication. The next thing to do is to call your rheumatologist and your obstetrician or gynecologist in order to manage your health and to be evaluated. They will be able to talk to you about what your options are in this situation. It is worth knowing that not all babies that are conceived on these medications will have a birth defect. And so talking about what the risks of birth defects are is really important so that you understand your situation. We have information about this on our website, www.lupuspregnancy.org, for both you and your doctor so that you can really have a useful and productive conversation. There's a couple medications for which we really just don't have enough information to know if they're safe or dangerous in pregnancy, and these are on our caution list. We recommend that you talk to your rheumatologist before you get pregnant if you're taking these in order to make a good plan that's safe for you. If you're thinking about getting pregnant, then start a prenatal vitamin now. You can buy this over the counter without a prescription, and the most important time to be taking it is before you know you're pregnant. Your rheumatologist or obstetrician will likely ask you to start taking an aspirin, just 81 milligrams a day, at the end of your first trimester. If you're taking any other medications for any other conditions or even for your lupus, please talk to your obstetrician about those because they're really the experts on these medications in pregnancy. So which doctor should you talk with? So everybody needs to have your rheumatologist on board when you're pregnant. They're the best people to assess how active your lupus is. In addition, everybody needs to at least be seen once by a maternal fetal medicine specialist, also sometimes called a perinatologist or a high-risk obstetrician. These are obstetricians who have had extra training to be able to manage medical conditions in pregnancy. Some people will also be followed by a local obstetrician. If you have a nephrologist, cardiologist, pulmonologist, hematologist, or really any other kind of doctor, then they also need to know that you're trying to get pregnant and make sure that they make any adjustments that are needed. Women with lupus might have other health conditions like antiphospholipid syndrome, hypertension, or positive antibodies, and these also need to be addressed before you get pregnant. As you see on the bottom of our sheet, there are some recommendations there, and please talk to your rheumatologist for more details. Pain is something that comes up often in pregnancy, and we have pretty limited options for managing it. Acetaminophen or Tylenol is really the best recommended choice, and many obstetricians want you to avoid NSAIDs like ibuprofen and naproxen. So what happens after you have your baby? Well, it's important to keep your lupus under good control at that time too. A lot of patients think that they're at very high risk for having a flare of their lupus after they deliver their baby. In the past, this might have been true, but now that we use medications like hydroxychloroquine and azathioprine during pregnancy and while you're breastfeeding, it's actually pretty rare to see a flare. In fact, all of the medications that are pregnancy compatible or on our go list are also compatible with breastfeeding. So you can take your hydroxychloroquine, your azathioprine, your prednisone, and others on that list while you are breastfeeding with very minimal, if any, transfer into the breast milk. So keep taking your meds and keep following up with your rheumatologist to make sure that you remain healthy. As you can see, planning for pregnancy is really important in order to have a safe and healthy pregnancy. If you've done this and realize that you're not ready to get pregnant right now, then it's really important that you get on birth control to avoid getting pregnant when your lupus is active or you're taking high-risk medications. We have great information about this at www.lupuspregnancy.org and a handout you can take to your rheumatologist and obstetrician that shows what medications are safe for you to prevent pregnancy. I hope that following these steps will help you get to a safe pregnancy. Definitely take this handout with you to your rheumatologist. It will help both of you figure out how best to have the safest pregnancy possible. Thank you.
Thank you, Dr. Close, for all the great information that you have shared with us about planning for pregnancy with lupus. And for those of you listening in, please check out additional resources with HopStep at lupuspregnancy.org or at the National Resource Center on Lupus. Thank you, and have a wonderful day.